appreciate that. Yeah, and thank you all for being here. People in Greenville pride themselves that we live in a very safe community, and indeed we do. But as we've seen in the last several days, it doesn't matter if you're in a safe community or not, horrendous things can happen. And with that in mind, we're all, again, on edge these days. At the same time, we have to have cool heads to be ready for everything that might happen. So today you're going to hear some remarks from our police chief, EMS, and the fire department, just to affirm that we have special training that's been going on for some time for these kind of events. Our first responders are always ready and trained and ready. At the same time, I think it emphasizes again the importance for all citizens to be wary of what's going on in their surroundings and being able to report things to law enforcement. So again, it's important that we affirm as a community that we're going to be ready, we're going to be trained, and at the same time, we're still going to be a community that values its public spaces, our public events that are so wonderful in downtown and all around Greenville, and we continue to be a welcoming and inclusive community in the midst of all of this. I'd like to turn it over now to Chief Ken Miller, who's going to say a few words about our training, what's going on behind the scenes, and also police visibility in our community that's very important as well. Chief.
Hold on, Chief.
Hold on, we're going to need to get some mics up here, Chief. They're just going to set them down.
The inner mic isn't working, so we want to be able to hear you guys.
I could do it again.
I didn't think you wanted to.
We had a mic check. It was working.
It's working, but we lost it.
Well, we did a mic check. Everything was working fine. That was the box. It's just short. Chief, there's one there. Yeah, just drop it over here. I'll call it. There you go. Good?
Yep.
All right. Thank you, Mr. Mayor. I just want to take a few minutes to share with the members of our public, members of our media, just some of the actions and steps that we've taken as an organization and collectively with other organizations to prepare ourselves for those kinds of situations that we're seeing pop up really all around the country. You know, some people say, well, that's going to happen somewhere else. It's not going to happen here in Greenville. It'll happen over here. But, you know, tell me who's heard of Townville, outside of South Carolina, and who's heard of Gilroy in California. You know, now we know where it's nearby and everything, but it's not, they can happen in a community anywhere. And so every public safety official and every public safety agency all across our country, they have to do things to prepare their agencies for the response. And not just the response and the aftermath, but as much as we can to prevent. And so we've taken steps in that area here in Greenville. We want to reassure the public that we've taken those steps. Doesn't mean nothing can happen here. It just means that we're doing what we can within our control circumstances that might lead to a situation occurring here. You look just this year alone, there are 5 mass casualty events that are active shooter related. You have Aurora, Illinois. You have Virginia Beach. You have Gilroy, California, El Paso, Texas, Dayton, Ohio, and you know the 58 people killed just 18 months ago in Las Vegas. And when you look at that that toll, it's catastrophic, and yet we can try as best we can to prevent it, and that's what we try to do here. So we have increased our training for our employees from 2 years to 1 year, and now from 1 year to quarterly. And when we talk about quarterly training, we're doing practical active shooter drill exercises quarterly now, moving forward, after taking 13 hours of training earlier this spring, all of us, including me. Anybody who's wearing a uniform has been through that training. And we are working to refine our tactics, our approach, We are working in partnership with EMS, and we have been for some time, and the Prisma Healthcare, as well as the USC School of Medicine here, and fire department in our trainings. We've also, just this spring, included the FBI in some training to look at the processing of a mass casualty scene after the fact. And we've engaged in some tabletop exercises with them to learn more about where our vulnerabilities are and how we can improve them. So as I've told other people who have asked, and I've done a couple of interviews this week on this topic, it is an evolutionary learning process. We try to understand what takes place in these other events, what went right, what went wrong, and we try to prepare and ensure and evaluate our training, our policies, our protocols to mitigate those vulnerabilities. We may not be able to capture them all. We certainly can't capture them all at once, but we're consistently looking at ways to strengthen our program, not only our training, our preparedness, but our protocols. And so training is just one recent aspect where we've really upped the amount of time that we spend on it, but we're also working more in collaboration with others. We still have additional work to do on that training front. Again, just like the tabletop exercise with the FBI, we need to work the back end of these, because when you have a situation that's bad, you have to make sure that you're putting together the right support structures after the fact to process the scene, to reunify families, to deal with the families who can't be reunified, to deal with the officers and the fire and medical personnel who are struggling through what they've just experienced in the service that they were delivering. And so there's a lot of pieces to a mass casualty event that have to come together, both on the front end in terms of the response, which is what most people pay attention to, and the back end, which is after the threat is mitigated or eliminated, and then you're dealing with the situation, the crime scene, the saving of lives, and the interactions with families and the public and the media. So there's a lot that goes on in these situations, and it's very difficult to get to hit every wicket. But our aim and our goal is to do that, and so we work very closely with one another here in Greenville to try and produce an environment that is fully collaborative, where we're training with one another, and where we are working to develop the capacities in our organizations to respond effectively. I will tell you also that a recent change about a year and a half ago to our protocol, again learning from some of these events, is to actually, when we see the threats, sometimes they're coming from school-age kids, sometimes they're not. Sometimes they're posted on social media. They get brought to our attention any one of a variety of ways. Sometimes we're in a feed and we can see it. Sometimes people forward it to us for investigation and evaluation. And we try to make charges where we can, because we can't involuntarily commit somebody for what they post on Facebook or Instagram or Snapchat or any of these others. But what we can do when we get them into the system is request a court-ordered psychological evaluation and subsequent treatment program that would be prescribed by a psychiatrist or a psychologist. And to us, that's the best way that we can work at trying to mitigate a person's potential threat, is to deal with the problem and the demons they're facing within that would cause them to lash out and act out in a way that would bring harm to any person or many people. And so we have requested through the solicitor's office, we've requested, I believe it's over the last 18 months, about 21 individuals receive a court-ordered evaluation. Now, we don't make that decision. That's a decision of a judge. But we have made those recommendations for threats. Again, what we're trying to do is prevent something from escalating and growing into a real possibility for violence. So that's a recent change in protocol, and it's a protocol that came out of some of the shootings over the past 2 years, 2.5 years. And so just like we're now training, and I'm going to turn it over to fire and EMS, but we're now, well, every year we've been training with EMS on mass casualty and active shooter trainings over at the School of Medicine on the Prisma campus. And with fire, we are hand in hand training the entry so that we can stop the killing and we can stop the dying as best possible. So fire is there with us, they're staging with us in our training so that they get the practical feel of what it would be in a real situation when we're entering a threat situation, and how we're protecting them and when they can move and when they can't move, because the firemen are no good to help anybody medically if they're injured themselves. So I'm going to turn it over. I'll let fire talk first. Tristan will brief you, and then we'll turn it over to Dr. Tom Blackwell. Sorry. Tom Blackwell from USC School of Medicine, and he is the interim EMS director here for Greenville County, and he will brief you on some of the efforts there. Thank you.
So I'm just going to reiterate some of the points that the chiefs made in relationship to collaboration, recognizing that Greenville City for us is our community. That made us recognize that we needed to come together with with the police department, with EMS, and understand how those three entities or those three organizations could work together. Chief talked about stop the killing and stop the dying, and that's where we can come into play. Statistics show that after the mass casualty, those folks that weren't able to get treated medically immediately have unfortunately turned into fatalities. And so the quicker that we can get inside the structures and the quicker we can get inside the scene to help them is the faster we can save lives. So that meant for the three departments to get together and understand how we could accomplish that goal for our citizens and do it effectively. We also wanted to make sure that we adhere to a certain standard. So NFPA 3000 is that standard that we follow. It helps guide our policies that we have, so that when we do respond to these scenes, not only with the training that we have built up, we can understand that with PD and with EMS, that they expect us to operate at a certain level. We are expecting them to operate at that level, and so we're cohesive as a three different entities, but operating under or as one unit. I don't really have much more to add. Chief alluded to our training. We are training with them annually. As you can understand as well, their mitigating of the circumstances or their prevention is at a different level than ours. We don't have that prevention aspect from a legal standpoint. And so like with any fire emergency, unfortunately, we're coming in after the fact. And so we want to make sure that when we're there, again, that we're doing the best that we can for our citizens and making sure that we can give treatment as fast as possible, as safely as possible, to help save those lives. And so I'd like to turn it over at this point to Dr. Blackwell.
Thank you. Good afternoon, Mr. Mayor, Chiefs. Thank you for inviting me to come over. I'm Tom Blackwell. I'm representing the healthcare community here in Greenville. I'm the Assistant Dean of the School of Medicine here in Greenville, University of South Carolina School of Medicine, Greenville, Prisma Health, and also Greenville County EMS. Our medical school is fairly unique amongst all 142 medical schools across the United States. We're the only school that teaches our first-year medical students to be certified EMTs, and this is their first class in their medical school career, actually in their future medical career. And the culmination of this 7 weeks of intense EMT training is a capstone exercise, a disaster drill that is in part a very extensive, very comprehensive active shooter drill. We're in our 8th year of our medical school program, and this year we'll have our 8th disaster drill. So we do it every year. There are two purposes for this drill. Foremost is our students. We want to ensure that our future doctors that are going to be taking care of these patients one day are able to take what knowledge we've given them up here to put into their hands and to apply that practically in an experience. But number two, and I would say probably the more important factor, is This is a community event, and because of our response community, their willingness, their generosity, they come in and train with us. So Greenville City Police Department, the Greenville County Sheriff's Office, Greenville City Fire Department, Greenville County EMS, and Greenville Emergency Management, we all come together. We plan this drill about 6 months in advance. We have representatives from every response agency as part of that planning process. We look for opportunities to identify gaps, to fill those gaps. We've done family repatriation. We have done interoperable communication. We've done incident command training. So this is an opportunity for all of our response agencies to come together and to train together. And again, it's a very unique opportunity. We run the drill 4 times in one day to get all 105 of our students through the system. Therefore, it allows us to make mistakes and then go back on the second iteration and identify more mistakes, correct the ones that we identified in round 1, and then we have rounds 3 and 4 where we can continue to correct gaps that we've identified through these drills. Again, we've done it every year. Our next drill is coming up on Friday, August the 23rd. And once again, it's a comprehensive drill that involves an active shooter. I think it'll take some notoriety this year just because of our events from recent, which before the events of 9/11, these were low probability, high consequence events. Unfortunately today, it's high probability, high consequence. So this community is better trained because of the efforts of working together and working collaboratively and interoperably and, importantly, interprofessionally. These response agencies get together with our medical students, our future doctors, and some doctors that participate and nurses that participate with us. And we all work together. We understand what law enforcement roles are, what fire roles are, what municipal government role is, what EMS the role for them, and so all of our future healthcare providers have a greater appreciation for what's out there. And so we're privileged to be part of this community, and we will continue having these drills as long as this school is in place, as far as I know. So thank you very much.
Thank you, Dr. Blackwell. And you probably don't know this, but Dr. Blackwell and I were in Charlotte together, and he worked with police on mass casualty exercises up there and actually led the mobile hospital in the Katrina, for the Charlotte contingent in the Katrina aftermath down to Mississippi. And I can tell you a couple other things that are important to know for the public to know. One, well, 3 things really. Event security. We do our best to try and mitigate problems at events. We know that there was a recently publicized situation where a car drove through one of our barricades at a prep site for an event on the Main Street Bridge. So, what have we learned from that? Well, we had one barricade that wasn't filled with water, and that was the one that person went over. The person had no idea that it wasn't filled with water. The person was not intentionally trying to drive through that area, came upon it, and just decided to drive on through it. She had stolen a car, carjacked the car, and was just driving it. So, but what we do know is that when we have a vulnerability, we need to secure that vulnerability, and that's what we talked about in the aftermath of that. So we can't let our guard down and our discipline down and not protect that vulnerability. So the car shouldn't have been one barrier over. It should have been covering that barrier. But there were a lot of vehicles going in and out, and the officer felt that that was okay to just move the barrier because it would appear like all the others that it would be filled. We know that that isn't the case. When we're trying to protect people and we're trying to protect property, we can't let that discipline slide. And that's the learning piece in that event. We're very fortunate that nobody was hurt in that event. So as we look, we're continually looking. Yesterday, we were up in the Charlotte and Concord area, and we were looking at a rack system that serves to provide a stronger barrier than the water-filled barriers to protect our event sites. We have a lot of special events downtown. Those special events are very important to the city. They're very important to our community. And we want to protect people through our visibility, through our security precautions, access control where and when possible, and certainly preventing people from driving through a large site with with many, many pedestrians. So, so we do try to secure events. Secondarily, we also provide training to the public. That training is called, it's titled Civilian Response to Active Shooter Events, CRASE, C-R-A-S-E. It is built on the alert model of avoid, deny, and defend. You avoid the threat if you can escape the area that the incident is occurring in, escape it. If you cannot, you try to deny access to you and to people with you. And if you can't do that, you defend. We put on a 2.5 hour training program that we have trained many, many people in our community. One of the lead trainers here, Lieutenant Long. He's here today. He's happy to talk with you afterward if you prefer to discuss what goes on in that training. We have trained all city personnel in that as well. And so that is training that is available to the public and we can schedule. The other thing is, and probably the most important thing, because we can't train everybody, is the public just simply needs to know if you see something that in your own intuition doesn't feel right, doesn't look right, and you're concerned about, you need to find an officer and report it, or you should call 911 and report it. That's our best way to intervene, our best way to disrupt, and our best way to prevent the kind of carnage that's been happening around our country. And if we need the public's help, just like we collaborate up here, interagency, and we do with the county sheriff's office, but just as we collaborate up here, we need that same degree of collaboration with the community. You're our eyes and ears. You're everywhere that we're not. You're sometimes in the same places we are, but you're everywhere that we're not. And when something doesn't feel right, let us know. Because that one thing that strikes your intuition as wrong, there's a reason for that. We're all built that way. And when something doesn't feel right, it's a defensive mechanism, and you should let us know. Give us a good description of the person. Give us a good description of the behavior that strikes you as odd. Don't just tell us somebody's walking through your neighborhood and nobody walks through your neighborhood. But if something really strikes you as odd behavior, tell us what that odd behavior is and give us a good description. Tell us where the person's headed and if they're driving a vehicle, what they're driving. We will intervene and do our level best to try and remove threats from our community and help make ourselves safer. And you're our partners in that. So at this point, I'll turn it over to the mayor. We'll take any questions that you have. Mayor?
We'll take some questions. But also, we just want to say on behalf of the city council and the city, all our residents, how much we appreciate our own very expert team of first responders. As you've heard, this has been training going on for some time now, and it's quite interesting to listen to their discussion of what works and doesn't work from other communities, because that's what we follow. And it was interesting, Chief, you and I were talking yesterday about the police response in Dayton, Ohio, and it's good to see an example of what did work. I mean, there were many lives lost, but it could have been many more. And the officers, the way they responded on that scene was truly heroic and very effective as well. Any questions or anything to our fine folks up here?
Yeah, well, you know, with the one of the largest events coming up fall for Greenville, that's got. Do you guys, are you working a new plan because of the recent events, or you already had a plan in place? I don't know.
We were talking about that too, because that is our premier event. There's no bigger event, and Chief, you put it in good words. Whatever we do there becomes sort of the ultimate in what we need to do all the time. But that's the great event for us in terms of doing the right thing and whatever we can do to secure that event. The other events are much smaller and even easier to manage. But yeah, a lot of new things are going to be tried at Fall for Greenville, and that's always been kind of the event that we try out most of our techniques, if you will, for securing the public. And I can't emphasize enough, he's always talking about this to us, about people reporting things and suspicious activities, whether it's downtown or any place else, and the Chief did a great job of emphasizing that. But we do all have a role to play in reporting suspicious activity and things that just don't look right in what he said, because they found that to be very effective. People who didn't quite act right, guess what, when the police checked in the situation, they had something going on there that wasn't so good. So it is an important message for all of us.
So it would be fair to say y'all will employ some new techniques in
I
this?
think that's fair to say. He mentioned the water barrels and how we secure the entrances into that festival. But you're exactly right. That is the event that we have. It's largest. It's where we would try all of our techniques, all the above. Okay.
Is there a committee one-on-one interviews as well?
Yeah, that's fine.
I had a question. My understanding on the rack system that you're talking about is that it's quite expensive. From a political point of view, y'all in charge of money. Is there a possibility of more money for something like that?
Yes, to answer your question, yeah, absolutely. And I think been that way for some time, actually, in terms of new expenditures for police protection activities. You go back in a budget of the city 10 years ago, you would not find these kind of budget items, if you will, and that's this kind of training that goes on too. But it's all the new normal, unfortunately, for all of us. But yeah, as soon as he's checking out different kinds of barriers, what's most effective as well as cost effective at the same time.
Yeah, if I may. So when you talk about the racks, they're expensive. They're not as expensive as putting hydraulic bollards in your streets and we talked about this too yesterday, or the lift pads, if you will, the steel lift pads and gates out of the roadway that are barriers that would prevent vehicles from coming through. Those are very, very expensive. They're expensive to maintain. So the total cost of ownership on these rack systems is certainly more than a plastic water barrier, but it's more effective than a plastic water barrier, and it's pretty easy to maintain and low cost of long-term ownership.
We thank you guys for being here and for
Thank you.
offering these words. We appreciate it.
Appreciate you for coming out. Thanks.
Yeah, he did tell me.
I do that.